Why older adults hear the same health tips again and again? You may have noticed this over the years. No matter where you turn, television, newspapers, the internet, or even casual conversations, the same health messages seem to return again and again. Eat balanced meals. Stay active. Get enough rest. They are familiar, almost too familiar. And for many older adults, hearing them repeated can feel puzzling or even tiring. At first, these messages sound reasonable. They are simple, easy to remember, easy to repeat. But after hearing them for decades, many people begin to wonder why nothing new seems to be said, even as life and the body continue to change. Part of the answer lies in how health information is shared. Health messages are often designed to reach as many people as possible. To do that, they rely on broad ideas rather than detailed explanations. Simple messages travel well. They fit into short segments, headlines, and brief conversations. But simplicity often comes at the cost of nuance. As people grow older, their experiences become more varied, not less. Bodies change gradually. Routines become established. Circumstances differ widely from one person to another. Yet health messaging rarely reflects this variety. Instead, it circles back to the same general themes. Another reason these messages repeat is that health communication often works in cycles. When a message is believed to be important, it is reinforced again and again. Repetition is seen as reassurance. From the perspective of public communication, repetition signals stability. But from the listener's perspective, especially later in life, repetition can feel like stagnation. There is also the matter of time. Many health messages are not new ideas. Some have existed for generations. What changes is the context around them, research methods, social habits, media platforms. Yet the wording often remains unchanged, even as the audience ages. This can create a quiet disconnect. Older adults may feel that the advice no longer speaks to their lived experience, even though it continues to be presented as universally relevant. Another layer is how health advice is remembered. Over time, explanations fade while short phrases remain. What was once a longer discussion becomes a slogan. What was once a question becomes a statement. As a result, people may hear the same message repeatedly without hearing the reasoning behind it. This can make health information feel shallow, even when it originally came from careful thought. It is also worth noting that health communication often avoids acknowledging uncertainty. Repeating familiar advice can feel safer than introducing complexity. But life, especially later in life, is rarely simple. For many older adults, hearing the same health tips again and again is not a sign that nothing has changed. It is often a sign that the way health is discussed has not kept pace with the realities of aging. Understanding this does not require agreement or disagreement with the advice itself. It simply requires recognizing why it sounds the way it does. Health messages are shaped by the need to be brief, repeatable, and widely understood. They are not always shaped by the depth of individual experience. Seeing this can bring a sense of calm. The repetition is not a personal failure to understand. It is a feature of how information is shared. Sometimes, understanding health information begins not with new advice, but with a clearer view of why the old advice keeps returning. This content is for general educational purposes only and does not provide medical advice, diagnosis, or treatment. Health topics discussed are informational in nature. For personal health concerns, please consult a qualified healthcare professional.